Hey, it's Jessica Namasan with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation here at Vive. And joining me right now, I have Guillaume de Zwirek. He is the founder and CEO of Well Health. Good to have you here.
Likewise, thanks, Jess.
All right, so Well Health, a little bit under the radar to me because you guys are like a white label service. So you provide patient communications, primarily text messages, but we're gonna get into the other stuff. And you do this for hospital systems. So this was cool though. You guys are like an infrastructure play. Very awesome. Tell me about Well Health in your own words though.
So I started the company because I was a patient. I was dealing with really intense healthcare experiences. A doctor told me I was at risk of sudden cardiac arrest, so I had to see a lot of specialists. And I was in my 20s, I worked full time, and everything, all the coordination was done on the phone. And it drove me nuts. You know, working 8 to 8, and I have to find time out of my day to call the call center, and they might not pick up, you might be on hold, and meanwhile, in my pocket, I can communicate with anybody asynchronously, and I figured you look at the healthcare industry, top 2 in terms of federal spending, top 5 in terms of GDP, touches every person in the world, you're super vulnerable. This industry should have the best customer experience. And as I started digging deeper, the research shows it was the third worst.
It is.
Cable companies, federal government are the only two that, and healthcare. So I was naive enough to decide that I would start a company to fix the problem. And now I can text my doctor, so it's great. And they respond very quickly.
That's awesome. That's so worth it because there have been plenty of times where I'm waiting for the doctor to call me back and I'm carrying the phone around with me, dying to not miss that phone call.
I will give you my doctor's phone number.
All right, fantastic, perfect. Okay, so text messaging, but text messaging that's translated into a number of different languages, and you're working primarily with hospitals. I got 400 health systems, right?
Yeah. So the idea is to remove as much friction as possible in the healthcare experience. As your conditions become more intensive or chronic, you might be pulled into apps, you might need to see the doctor more frequently, but for the vast majority of people in the States, you see the doctor once a year, there's some coordination before the visit, after the visit, that should be in the pocket, that should be a phone number that you recognize. Obviously we need to reach every person, in the country, so we try to be culturally sensitive, we support all the predominant languages that are spoken in the US, and then the interesting thing is that the call center staff of the hospital is one of the main users of the software.
Okay.
So we have over 30,000 agents across the country who, when our bots can't resolve a case, they get assigned the text message. So if I'm texting the doctor, it's going to go through a bunch of rules before it assigns my case to an on-call doctor to respond to me. They'll respond in the appropriate language, and literally across the board, I think 97% of cases get resolved within a day.
That's incredible. Okay, so are the doctors on staff with you guys, or how does that work?
So we don't do any services. It's all technology, like you said, all white labeled. You would not know as a patient that we existed. The only way you would know is if you were texting with your doctor. It's probably us behind the scenes doing all the coordination and rules and logic.
I love that, and I am watching this infrastructure space just explode in healthcare. I mean, I feel like there's a number of different companies that are offering their services white labeled. They don't want to be the one that's facing the patient. They don't want to own the relationship. They want to let the hospital system, or they want to let the health plan, or whoever it is who has that forward relationship with the member or the patient, be the one who has that relationship. So talk to me about your decision to go that way, especially when there are so many companies in this patient communication space that are like, nope, I want to be the digital front door and I want to have the relationship with the patient. So what made you go the other way?
There's a lot of people competing for the patient's attention, and I think this comes back to the founding of Well. I started this company because I had a problem, and my trusted relationship was with my provider. My friends and family, it was with their provider. My doctor's name is Dr. Haig. He will always be my doctor. I used to try, for 15 years, I would fly to the Bay Area to see my dentist. I don't know if you've stayed with the same dentist.
I have actually for 20 years in Chicago.
So it's a thing, and you don't live in Chicago.
Nope.
So that relationship, I really believe that's where the relationship is. So how do you empower the doctors who are tremendously stretched for time, who have tremendous pressures in terms of revenue and margin? How do you empower them to manage that relationship? That's why I started this company. I didn't start it to make money, I didn't start it to raise money, I started it because I wanted to solve that problem for me and for my friends and family. So everything has been about creating that relationship, eliminating the friction. I want to be invisible, and over time, I actually think building a strong relationship with the provider will allow us to layer other people in the healthcare ecosystem. So most people who aren't from healthcare, they might not know what a payer is.
Yeah.
They don't know what a pharmacy is, and that a pharmacy is different than your health system. They might not know that CROs do recruitment for trials. Like all of that is, all of those constituents, if we nail this, should all live on the same platform, and for the patient, it should be completely seamless.
Agree, 100%. All right, so one of the other things that surprised me a lot about Well Health is just how well funded you are. Like, unbelievably well funded, in my opinion. Like, for not really having like any big splashy releases about this stuff. So, $97 million that you guys have raised to date. Dragoneer is one of your investors. Others are in there. I mean, talk to me, I guess, about like, why not talk a little bit more about that funding that you guys have? I mean, usually that's like one of the things that, I mean, I'm a hype machine. Like, people come to me all the time when they raise big money. I haven't talked to you yet. What's going on?
So when well, it's because my PR person made me do it. Just kidding. No, it's because when I started this company, like, I went through the trials and tribulations of starting a company. I heard 200 no's. 200 people told me my idea was stupid, and I knew it wasn't because I had the problem and I knew nobody else was solving it at the time. And I thought raising money was easy. I was fooled into thinking I create a pitch deck, go on Sand Hill Road, knock on a couple doors, somebody writes me a big check. No, and that's what I did. No, that's what I did. I wrote a pitch. I went on Sand Hill Road, and I knew some of these people, knocked on their doors, and they all said no. Then 200 no's later, I was like, I think I'm not the exception. I think this is how it happens for most people. So I've actually stayed away from publishing our fundraising or anything of that nature because I want to normalize, like, what is the normal hard journey. Most companies that have multi-billion-dollar exits, it's from the grit. Like, it's a lot of hard work. So, and I think the measure of a successful company isn't how much they've raised, but how much they're solving the problem at hand and how much people like the product. So hopefully we're making a small dent there.
I like that. I like that. It is a game of survival, especially in healthcare. I mean, the healthcare technology companies, they take a long time to reach maturation. I mean, one of those other infrastructure companies, Amwell, I mean, they've been around for a long time and still growing. So yeah, I think that's commendable. All right, so what's next for you guys? I mean, what's on the horizon? How do you continue to grow your business? I mean, I know there's a lot of health systems out there that you could partner up with who would become your clients. That sounds great. But like, do you expand into other types of patient communications beyond text? Like, how do you, in a world where people do want to own that patient relationship and see a lot of upside in having that, what is the growth strategy for Well where you do not do that?
So we talked about how I don't like big fundraises and sharing big numbers, but there is a number I do want to share, which is we're putting $32 million into R&D this year. And I want to share that number because if we solve this problem well, it's going to look really simple. That the elegance will make it look like this is the easiest thing in the world to do, but the orchestration, the configuration, the rules, like, that takes a lot of investment. That takes a lot of time and energy. So that is our big focus right now, product. I hired a new SVP of product. We just brought in an SVP of engineering. We're really focused on making the platform even better, extending the use cases that we can support. Over time, we really do want to power every single interaction that happens between patients and healthcare. So that means, looking at things like the telephone and the conversations that you have with agents, being able to potentially power those conversations, transcribing them, feeding those back into our database, running AI and ML models against those so that we can better predict outcomes for patients. And then over time, looking at the other constituents in healthcare, like your health plan. So let's say you were texting with your doctor, and it turns out, so my wife just gave birth 6 weeks ago.
Oh, congratulations.
So she gets hit with a $2,000 bill, well, and probably costs $30,000, for her 3-day stay. And
baby's priceless.
Baby is priceless. Yeah, that's what I'm going back home for. But let's say you got a text about, that bill, and you were told that you hadn't hit your out-of-pocket yet, and you disagreed.
Yeah.
So you would want to text back and say, like, no, I didn't hit my out-of-pocket. Today, if you're only serving the healthcare provider, that's a dead end.
Yeah.
Because you have to talk to the plan, you have to talk to the payer, but you don't realize that as a patient.
Yeah.
So I think it's going to be critically important for us to really capture the entire provider market and empower providers to build those great relationships and then layer in the other constituents in healthcare. Look, we have 400 of the 6,000 health systems in the US. We still have a lot of doors to knock on, so there's still a lot of work to do.
All right, well, we will keep our eye on Well Health, even though we may not know the name Well Health because your whole business is white label, and I love that.
And it's a pretty generic name. So
I love it. Well, yeah, way to fly under the radar real low. I love it. It's a pleasure to talk to you.
Likewise.
We'll have to talk back with you again. Check in with us as you guys grow and scale, please. I'm Jessica DeMassa, and for more with the who's who of health tech as they are changing the way that we do healthcare, check out my YouTube channel over there at youtube.com/WTF Health. I'll talk to you soon. Thanks.